Hello to everyone, I'm Jasna Karacic and I will present the role of global health diplomacy to support medical doctors in the pandemic. Global health diplomacy is a novel concept in health with a focus on the interactions in foreign affairs. Health diplomacy coordinates policies for improving global health, which was particularly during the COVID-19 pandemic. This study aimed to evaluate how global health diplomacy can help healthcare professionals and identify the problems for them in practice, as well as moral dilemmas to providing only emergency treatment in the hospital lockdown. Methods: we perform the interviews with participants responsible for health in the EU as a member of government and health-related sectors. Interviews were conducted in English, voice recorded and transcribed. The data analysis included coding of the transcripts, categorization of initial codes, and identification of them using in vivo software. All participants signed the informed consent, and research was approved by the University of Split Medical School Ethical Board. In results, participants agreed that the global solution to this pandemic is to ensure universal access to the healthcare. Global diplomatic response to the pandemic was uncoordinated. Participants stated that the pandemic hit doctors especially hard, as they have to balance the fear about their safety and providing care. Healthcare professionals are also faced with the ethical and moral dilemmas regarding limiting access to the healthcare during national lockdown. The participants agreed that the best example of coordinating a global health diplomacy effort was the centralized EU approach to securing supplies and development of vaccines. Participants stressed the importance of the patient rights in the global health diplomacy. They discussed what can be learned from the failures of diplomatic response to COVID-19 pandemic and how future global crises should be handled. In conclusion, we identified the lessons that global health diplomacy can apply to help doctors. Global health diplomacy in times of COVID-19 underlines the increasing politicization of global health. As the pandemic continues, it is worth asking what global health diplomacy will look like in the aftermath of COVID-19. Thank you for your attention.